Okay, so the next patient, he's a 4-year-old. He's an X27 weeker. He was born by C-section for late D cells. It was an emergent C-section. His APGARs were 4 and 8. He was transferred to the NICU for prematurity. He had some RDS. He got surfactant times 2 and was intubated for about 2 weeks. His course was further complicated by neck that was treated just medically with antibiotics. I can't remember which ones, but he never required surgery. And then he did end up developing BPD, and he was on diuretics for about 2 years, but he follows with Dr. Sharma, and those were weaned off in 2010. And then he also had steroid exposure while he was in the NICU. He followed with endo for that, and I think everything's okay. He's not on steroids or adrenal insufficient anymore. Also had some osteopenia of prematurity that has since gotten better, and some anemia of prematurity that has improved as well. His last transfusion was in 2009. Okay. And then he does have reactive airway disease. He was at first admitted about at the age of 2, and at that time he required a 4-day hospitalization for reactive airway disease, and he had RSV. And he did pretty well with that. And then his second hospitalization was, I think, like when he was 3, a similar story, a URI and wheezing. And then most recently, he was admitted about 6 months ago with URI and wheezing. He needed some IV fluids at that time because he was pretty dehydrated. But he got a 5-day course of steroids and some albuterol and went home after about 3 days. So he came in yesterday with fevers to like 100 or so for the past couple days. And he's had some increased work of breathing and wheezing and some URI symptoms as well. Are you listening?
Yeah.
Okay. Some URI symptoms as well. So he's been on albuterol.
Excuse me. My patient in 66 just had a DSAT episode down to the 50s, apneic episode, and the blood pressure is like 60/40.
Are you sure?
Okay.
Yeah, I'm positive.
All right.
But
well,
we're kind of like
signing out.
Yeah, we're signing out.
Seriously?
So we're almost done. We only have like 2 patients left.
Okay,
and
well,
then
you know
we'll
what?
come and see it.
I'm going to call a code right now.
Well, I mean, fine. We have to finish signing out.
Yeah. So the
we'll be
PICU
there.
attending can
The
just
Well,
take
the
it.
PICU attending, they're putting somebody on ECMO over there. They don't really have time to come over here.
We'll be done and sign out in
So,
like
yeah,
2
2
seconds.
seconds.
I'm just
2
gonna call
seconds.
a
We'll
code.
be right there. Okay.
We're just talking about this really important
Okay.
kid. What is this kid's diagnosis again? Like,
So he has reactive airway disease exacerbation. So he's on Q3 nebs. Should go home tomorrow. I wouldn't
Okay.
meet him. He's been pretty happy on Q3 all day. So just, it is what it is.
can you believe her? She
I
was
don't know
like,
which patient
all
was
up in my
66.
grill.
We should figure out.
yeah, whatever.
66. Oh, God.
It's like safe zone, you know?
I know. It
Safe
should be
zone.
protected.